Normal hemoglobin levels exhibit notable variations between genders. Specifically, women typically present hemoglobin levels ranging from 120 to 140 G/L, while men typically range from 130 to 160 G/L, as determined by manual methods. Understanding these established ranges is crucial for accurately diagnosing conditions such as anemia. The manual determination method, although not renowned for its high accuracy, remains a straightforward and pragmatic approach specifically designed for screening tests. This methodology utilizes a salt hemometer, which enables the measurement of hemoglobin levels in a user-friendly manner. The incorporation of hydrochloric acid during the testing process significantly contributes to achieving reliable readings. The methodology necessitates careful and precise measurements to ensure that the determination of hemoglobin levels is executed correctly. The use of a precise volume, such as 20 μl, is vital to ensuring that the accuracy of the chemical reactions observed is maintained. Such precision is indispensable for deriving dependable and valid results throughout the experimental procedures. A discernible color change of blood to a brownish hue serves as an indicator of hydrochloric acid hemoglobin formation, representing a significant chemical transformation. This provides insight into how hemoglobin interacts and reacts under acidic conditions, demonstrating the complexity of biochemical processes. In the experimental setup, careful addition of distilled water is required until the solution achieves the standard color. This specific step forms an integral part of the procedure, as it is essential for maintaining consistent experimental conditions and ensuring validity. The methodology necessitates meticulous mixing and color comparison to evaluate the concentration of hemoglobin. This clearly highlights the paramount importance of precision in measurement, as it directly influences the reliability of experimental outcomes. In addition, alternative methods for hemoglobin determination are explored, including photocolorimetric techniques. These offer enhanced accuracy and are particularly beneficial in clinical settings, where precise measurements are tailored to inform medical decisions. Ultimately, normal hemoglobin levels are influenced by both gender and age, necessitating specific ranges for women, men, and children. This underscores the importance of contextual considerations when interpreting results in varied populations, thereby enhancing our understanding of hematological health.